Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOS and its relationship with metabolic syndrome. Many people are suffering with metabolic syndrome, but they do not know that they are suffering with this kind of syndrome, right? So what is this metabolic syndrome? What are the symptoms of metabolic syndrome? How this metabolic syndrome paves way for different kinds of other risky, diseases? We will know all of this stuff in this video. Along with that, we will be knowing what is the best line of treatment to treat PCOS as well as this metabolic syndrome. If you are explaining like this, it might not give a right picture. So we will be explaining on the screen with pictures so that you will get a better idea about this metabolic syndrome as well as PCOS. So let's dive into the topic to know more about. Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOS and its relationship to metabolic syndrome. So what is this metabolic syndrome? As you can see, metabolic syndrome constitutes of 5 different symptoms. The first symptom being low HDL. What is low HDL? That is, HDL means high density lipoprotein, which can, in a common language can be also called as good cholesterol, right? Whenever there is decrease in this good cholesterol, that is one of the symptoms of this metabolic syndrome. And whenever there is high fasting blood sugar, which is whenever you are on fast, like for example, when you take samples for blood sugars, you usually do it in 2 manners. One is taking FBS and PP, which is fasting blood sugar, when you are on fast and you have not consumed anything for breakfast, and then one after your breakfast, after 1 or 2 hours of your breakfast, which is called as PP, postprandial. This is one set of examining the blood sugar. The second one is random blood sugar, right? So in your fasting blood sugar, if the blood sugar is more than 100, then that can also count as metabolic syndrome symptom. What is the third one? Larger waist circumference, more than 40 in men and more than 35 in women, is also a feature of metabolic syndrome. By even just these 3 features, you might be understanding majority of people have these things right now, which is increase in FBS or increase in HbA1c, which is your either in your pre-diabetic stage or your early marginal diabetes stage, and your HDL or your good cholesterol is already down, and your waist circumference is a little bit more than your shoulder circumference, or it can also be called 40 in men and 35 in women. Apart from that, what else should you be having to be diagnosed with metabolic syndrome? Is having high triglycerides. What is high triglyceride level? Whenever there is a drop in HDL level, usually because of unhealthy food habits, there is increase in unhealthy cholesterol also, which is direct cholesterol, triglycerides, LDL and VLDL. But in metabolic syndrome, we take triglycerides where it is more than 150. Majority people who are working at desk jobs have this symptomatology, which is decrease in HDL, increase in triglycerides, increased in waist circumference, and also there is increase in blood sugar level. Apart from that, little bit amount of people might be also having high blood pressure, which is more than 130 by 85 mm of Hg. See, if you are someone who is below 50 years of age, your blood pressure should usually be 120 or 125 to 120, or it can go a little bit down, which is 100 to 120, right? But if you are above 50, then 130 is considered common to you, right? Why? Because how is BP counted after 50 years? It's counted as 90 plus your age by 80 or 70. If the diastole, that is the below number, is going more than 80, or the above number is going more than 90 plus your age, that means you are having hypertension. So in the metabolic syndrome, if you are 25 years of age and your BP or your blood pressure is more than 30 and your diastole, which is the lower part of the BP, lower count of the BP is more than 80, you might be experiencing hypertension, or you might be experiencing essential hypertension, or you might be experiencing a symptom of metabolic syndrome, right? So if you're experiencing any of these 3, like we have 5 symptoms, right? Any of the 3 symptoms in the metabolic syndrome, then you're positive for metabolic syndrome. People who are watching this mostly will have majority of the symptoms, which is 4 symptoms, and like minority of the people will have even 5 symptoms also. Okay. So how is PCOS developing, or how is it triggering this metabolic syndrome? We will see. What is the connection? PCOS has, it makes this metabolic syndrome worse, and also it can trigger the metabolic syndrome in people who do not have it. How? It will trigger the abdominal obesity, it will trigger high BP, it will trigger high blood pressure, it will trigger cholesterol formation. How? With insulin resistance. Insulin resistance is one of the key factor in PCOS which will trigger the metabolic syndrome. You have to understand, if you have seen our older videos, you would be understanding that PCOD and PCOS are a little different from each other, and in PCOS there is a symptom called as prominent symptom called as hyperinsulinemia or insulin resistance. That hyperinsulinemia and insulin resistance can trigger this metabolic syndrome. Apart from that, PCOS also constitutes of hyperandrogenism, which is increased in DHEA or increase in your testosterone level in the body. That can also trigger BP or blood pressure. And apart from that, you know that PCOS people usually, if there are 100 people who are suffering from PCOS, 60 members of people who are suffering from PCOS do suffer from obesity, right? They can change their shape and they can either shift into an apple shape or an enlarged pear shape, not a normal pear but an enlarged pear shape with this abnormal deposition of fat in the lower abdomen and in the thighs and in the buttock region, or there is abnormal accumulation of fat in the upper abdominal area, which will give rise to the apple shape. So you have all of these symptoms connected to PCOS. Now, how are these causing this metabolic syndrome? We will be letting you know. And you have to remember that there is sympathetic system activation because of hyperandrogenism in PCOS. It all seems a little bit, off the shore, or it seems a little bit confused, right? So let me explain to you in detail how PCOS is causing or is triggering or is maintaining this metabolic syndrome. You know PCOS, right? So what does PCOS stand for? It stands for the pi category, which is polycystic ovaries, irregular periods, and excess androgen. So we have first one is excess androgen. Apart from that, because it is a syndrome, it has insulin levels increased insulin level or hyperinsulinemia, which has insulin resistance. Fine. So these two are the culprits. So what happens exactly? Insulin is supposed to make the blood sugar level go down because it is like a gateway through which the cells consume the blood glucose level and they utilize it for their day-to-day activities. But whenever there is hyperinsulinemia or insulin resistance, why is it happening? Because in PCOS, what happens is, usually if this is the lock, this is the cell's lock, and insulin is the key. It opens up, glucose goes in, and the blood glucose level comes to normal. But what happens here in PCOS is, there are other antibodies which are acting, or other molecules in our body which are acting like insulin. They will go and they will, attach with the lock. They will not open the lock, they will not close the lock, they will just attach. So that insulin is blocked here. So there is no blood sugar which is getting lowered because there is no blood going into the cell. First mechanism. Second mechanism, insulin is the same. The receptor is also same, but this little molecule in the receptor has changed. So this lock is not working now. So there is insulin level is increasing in the body. Why is it increasing? Body is thinking because there is low insulin, the blood glucose level is spiked up. So we have to increase the insulin so that the blood glucose level will go into the cells and it will come down. But here the problem is not with the insulin, the problem is with the receptor. The problem is with the changes that are happening because of PCOS in the receptors, right? So there is increased insulin, there is increased blood sugar, but the cell is not able to use the blood sugar. So what will happen? You will have sweet craving because body is thinking that there is no enough sugar for the body to run. There is no enough of ATP to run. So what happens? It gives you sugar craving. It gives you fat craving. It gives you this craving where you consume a lot of simple carbohydrates. Whenever you're consuming simple carbohydrates, blood sugar level is already increased and it will furthermore increase. Insulin is already there, but it is not able to open. So the body will think insulin is less. So it is triggering again insulin. So there is lot of insulin, lot of blood sugar. What will happen in that condition? Insulin resistance condition, what will happen is that, see, insulin has other properties also. It will help in formation of fat, okay? And it will help in formation of fat and it will not allow fat to be broken down, or it will not allow breakdown of fat. So it is helping in formation of fat, it is helping in not breaking the fat, and it will help this adipose tissues to become hypertrophy, okay? This small adipose tissue which is supposed to be 1 centimeter is becoming 10 centimeters. I'm just telling you, otherwise, it is not the exact measurement. So what is happening? The fat is being stored. The fat is not being broken down. The adipose tissue which is supposed to be this much is becoming hypertrophied. Apart from that, what is happening? Insulin along with this androgen level, they will trigger the sympathetic system so that usually blood vessels which are carrying the blood usually dilate. They relax, okay? But sympathetic system, whenever it is activated, they constrict, right? Whenever they're constricting, what happens? Blood pressure rises. So what are you getting here? You're getting, there is decrease in good fat because you're not consuming anything healthy. There is increase in triglycerides because you're consuming sugars and bad food. There is increase in abdominal fat because of the fat storage, and there is increase in BP, which because of the hyper androgenism and hyperinsulinemia. So all of this will cause or will constitute for metabolic syndrome. So what is there? HDL is there, triglycerides are there, and then you have the fat which is being deposited, you have the hypertension, and you have the fifth feature, which is increased blood sugar, which is there already because the blood is not being utilized by the cells. So all of this will constitute for the formation of metabolic syndrome. Many people are suffering with metabolic syndrome, they just don't know they are suffering with metabolic syndrome. They don't know that there is a tagline given to the symptoms that they are suffering with, right? So if you understood how PCOS will maintain it, will trigger it, and will help in not losing weight. PCOS, if you're having a PCOS and insulin resistance, you know that insulin, whenever insulin is there, you're not supposed to, or it will not allow in fat breakage, right? So that is why even if you're cutting down the calories also, you're not losing as much as weight as you're supposed to lose because of hyperinsulinemia, right? So you've understood how PCOS and metabolic syndrome works. Let's see what is the best line of treatment for both of these. Now we'll get into the conventional form of treatment or the allopathic form of treatment or the common form of treatment that people take, which constitutes of, for blood pressure, they will be giving you AC inhibitors or beta blockers. For hyperlipidemia, they will be giving you statins, and for blood sugar, they will be giving you metformin. Apart from that, to treat PCOS, they will be giving you hormonal contraceptives. Because there is increased androgen level, they will be giving you anti-androgens, and because there is no ovulation in PCOS, as you already know, and ovulatory cycles, they'll be giving you ovulation inducers. So what is wrong in using all of these medicines? The problem is that first and foremost, we have to consult a lot of doctors. You have to consult a gynecologist for your PCOS, you have to consult an MD general for your metabolic syndrome, and apart from that, if there is increased hypertension and your heart is also involved, you have to consult a cardiologist. And also PCOS has other symptoms like hair fall, acne problem. You have to consult a dermatologist and you have to consult a trichologist, right? Even after consulting so many people, even after taking so many medications, there is no procured or pinpoint cured cases through allopathic form of medication for PCOS or for this metabolic syndrome. Okay, apart from that, there is also another drawback, which is side effects. All of these medications do have side effects. What are they? If you are using hormonal contraceptives, you will be having weight gain, you will be having oily skin, you will be having hair fall, you will be having acne. Apart from this, as soon as you start using statins, or if you're starting using anti-androgen or ovulation inducers, as long as you're using them, it is fine. When you stop it, the symptoms revert back. And also, if you are someone who's planning for pregnancy, you cannot use contraceptives. And also, all of this will have, apart from the side effects that they have, because of taking these many medications, your gut bacteria is also destroyed, right? So there is a form of treatment which can give you better results, better outcome without side effects, which is nothing but homeopathic form of treatment. So in homeopathic form of treatment, what we do is, we are taking you, even though same family members are suffering with same set of diseases, same set of symptoms, there is an individualistic nature in each of them. In homeopathy, we are not going to give same medicines for of the family members who are suffering with same symptoms. We take each case, we analyze how individual they are from the rest of the family. We take the family traits, we take your individual traits, we take your physical symptoms, that is the physical representation. We take your mental symptoms also, how you're reacting to certain things, and then we prescribe a medicine which is tailor-made for you, it is custom-made for you, which will help in, it will be safe, completely safe, without side effects. It will be effective. It will manage your hormonal imbalance. It will manage your excess androgen level. It will manage your irregular periods. It will manage your metabolic syndrome. And it will also alter, if proper constitutional medicine is given, it will alter the cravings also. There are patients who come to us at Fidicus Homeopathy, they have particularly craving for undigested food. What is undigested food? They have craving for chalk, they have craving for sand, yes, sand is also there. They have craving for uncooked rice also. All of this are also inherent features of PCOS in certain section of people, especially who are obese. This kind of characteristics, whenever patient presents, whenever homeopathy doctors ask them, they are like, they're shocked, because They do not also recognize that doctors ask these kind of questions. Whenever we ask them, they tell us that they have this kind of cravings for undigested food, and after giving a proper constitutional and miasmatic remedy, the cravings will decrease and the craving for healthy food will increase. That's also there, right? And apart from that, it is balancing everything. And by balancing everything, by balancing your hormones especially, if you use it in a timely fashion, what you will be having is you will be having better results. Your fertility rate can increase, your PCOS can come down, your polycystic ovaries and USGs can come down, your hyperandrogenism can come down, your hyperinsulinemia can come down. And apart from that, the recurrence rate compared to allopathy is less in homeopathy. Your symptoms will be relieved, you will be cured, and we can prevent further more recurrences of this disease. If you're someone who's suffering from PCOS, PCOD, or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options. One is the online consultation option, and the other one is in person or the offline consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can contact us in person. Or if you're staying far away from us, you can contact us online through audio consultation option or through the video consultation option. Once the consultation is finished and your investigations are verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India or any state in India, you will be receiving medications within 3 to 4 days. If you're staying in USA, 3 to 5 days, and across the globe anywhere else, it will take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, or message us. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from PCOS, PCOD, bulky uterus, dysmenorrhea, fibroids, or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Why is Fidicus Homeopathy the answer? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 important principles. First of all, we are experiencing good success rate in people who are suffering from PCOS, PCOD, bulky uterus, fibroids, dysmenorrhea, cervical erosion. The success rate is really good. And apart from that, the transparent treatment here at Fidicus Homeopathy. There is no grey area between the patient and the doctor. The prognosis is clearly explained to you. And personal care here at Fidicus Homeopathy is top notch. Any sort of queries or myths, any sort of doubts that you have will be explained to you very clearly. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you. So today in this video, we have learned about PCOS and we have learned about metabolic syndrome. What is metabolic syndrome? What are the symptoms of metabolic syndrome? How it can cause heart diseases or other risky chronic diseases, right? And if you have any other sorts of doubts regarding PCOS, or it can be PCOD, or it can be metabolic syndrome, or any other female reproductive organ diseases, you can comment in the comment section. We will read it and we will reply back to you. And if necessary, we will be making a video on any of your queries if required. And we will meet you in the next video. Thank you.
Fidicus Homeopathy.